The problems with our current healthcare system, brought to you by Whole Washington for universal healthcare in Washington state. Problem number one, our healthcare system is too expensive. Problem number two, too many people do not have access. So, first, our healthcare system is too expensive. The per capita expenditure for healthcare has gone up 7 times over the past 50 years. And it has done this despite this being adjusted for inflation in constant 2022 dollars. Seen another way, with just the most recent window from 2000 until now, you can see that medical care has outpaced the inflation of all goods and services by about 35%. Despite spending all this money, the United States significantly underperforms on lifespan. The United States spends more than double the average comparable country. The closest to spending as much as we do are actually the two nations that have the system that is closest to us. The primary problem in the United States is our private spending. Our public spending is actually on par with many other countries, but our private spending is absolutely through the roof. If we look at the healthcare spending per capita for the United States, we can see that we massively outpace every other comparable country when it comes to inpatient and outpatient care, where we look at prices that are almost 3 times, about 2.5 times, as expensive. Additionally, other categories of interest for the United States is we spend almost double on prescription drugs and medical goods. Administration is 3 to 4x in terms of spending in the United States compared to the average comparable countries. A really good view of our prescription drug problem can be shown through Ozempic. So this is actually, as of 2023, current Ozempic prices in the US are about $1,000. And if you look at our comparable countries, you can see that even the most expensive, it's $170, and the average of those is a little over $100. So we're looking at almost 10x the price. And other weight loss drugs follow a similar trend. And this is despite the United States being one of the most obese countries in the world. Even within the United States, the administrative costs under Medicare are significantly less than that under private insurance. An analysis done by Gerald Friedman for Washington showed that provider and employer administration is a huge part of the savings that would come through switching to a single payer model from our current model. And why is it so bad? There's money in politics. Healthcare spending accounts for almost 18% of GDP, and insurance companies are a huge industry. They're pulling in over $1 trillion in revenue. Additionally, big pharmaceutical companies are another huge industry that exists in the United States to take advantage of people's sickness. Now, let's go to our problem number two. Our healthcare system excludes too many people. Americans do not have healthcare security. In the United States, about 8% of people are uninsured. In Washington state, we're a little lower than that. Approximately 350,000 medical bankruptcies per year. This is about 0.1% of people. And in Washington, we have a very similar rate. 10% of US adults have medical debt. In Washington, it's about 6.5%. About 1 million yearly avoidable deaths occur in the United States. And we have about 7,500 in Washington, a little lower than the rate nationally. Life expectancy versus income is incredibly depressing in the United States, with our lowest income people significantly underperforming our highest income people. This all comes down to access to quality health care. The percentage of adults who reported barriers to accessing medical care in 2023, about 45% worried about the ability to pay medical bills, about 28% delayed or did not get healthcare due to costs, 11% had difficulty paying medical bills, and 11% had no usual source of care. And so these are all significant problems. Consultation skipped due to costs. In the United States, 27 out of 100 patients skipped consultations due to costs. The average is at 7%, meaning we have about 4 times the access issues as the average comparable country. The percentage of adults who delayed or did not get health care due to costs is shown here. And for all adults, it's 28%. For communities of color, like Hispanic and Black communities, it's actually significantly higher, whereas Asian and white communities see it significantly lower than that line. Younger people are more likely to delay their care than older people are. People with worse health outcomes are more likely to delay their care. Uninsured people are significantly more likely than insured people. In Washington state, we can see that our more rural counties tend to have higher percentages of people without health insurance, whereas our more urban counties, like King County, tend to have very low rates of uninsured. The maternal mortality rate, the deaths per 100,000 live births, is so much higher in the United States than any comparable country. In fact, more than 5 times the average comparable country. This is not okay. So not only does our healthcare system, by its cost, discriminate against Hispanic and Black communities, but it also discriminates against women, particularly women of color. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org.